Good morning, everyone, from the very sunny Pacific Northwest. Brad was called away today, so he asked for me to fill in for him to do this presentation. I'm Teresa Hutson, and for those who don't know, I lead our HR legal group. But for those who do know, it's probably because I've been on the team working to shape and act on Microsoft's COVID response since day one. I've worked closely with many of you and with many others from across Microsoft to address our pandemic response as well as our return to work policies and procedures. I've had the great privilege of being on many calls with Dr. Tom Lynch and look forward to chatting with him and members of his team in more depth today. Fred Hutch and Microsoft were both born in 1975, as was I. And we've all grown up together. We're part of the bedrock of Seattle's innovation ecosystem. We are connected by shared commitment to improve the human experience and by a collaborative community of innovative employees. We're also connected by leadership. Satya Nadella serves on Fred Hutch's board of trustees, as does Brad's wife, Kathy Surace-Smith, who is board chair. We've invited Dr. Tom Lynch, Fred Hutch's president, and 3 leading experts to share the latest insights about emerging from the pandemic. Hutch researchers have been on the front lines of the pandemic since the very beginning, tracking the virus, learning how it behaves in our bodies, developing tests and treatments, leading massive vaccine trials for the federal pandemic response, and vaccinating people. After Tom and I talk, we'll hear briefly from each panelist, and then they'll answer all of our questions from the chat. So now I'd like to introduce you to Dr. Tom Lynch. Tom is president and director of Fred Hutch, and he holds the Raisbeck Endowed Chair. He's a lung cancer doctor, a pioneer in precision medicine, and a leader in translational medicine, moving laboratory science treatments that benefit patients. Before joining the Hutch, Tom held leadership positions at the Yale Cancer Center, Mass General, and Bristol Myers Squibb. He started at the Hutch in February 2020, just before the pandemic hit. Tom and the Hutch continued to advance cancer research in the past year and a half, while also playing a pivotal role in the global scientific sprint to end the pandemic. So Tom, now I'd like to welcome you to the screen.
Teresa, thanks so much. I am delighted to be here today. I want to thank you, I want to thank Brad Smith, and I want to thank Microsoft for inviting us to come and talk about COVID, where we are, and what the future looks like, because it's been an incredible past 20 months when you think about what's happened to our world, what's happened to our workplace, what's happened to our families. It's been really remarkable. And Microsoft, when you think about it, we've always used your guys' software all the time, but Teams became kind of personal, okay? Because you enabled us to be able to work remotely. And when you look at how well certain roles at organizations, and I'm sure, Teresa, that you're looking at this within Microsoft, just like we're looking at this within the Hutch, certain roles actually worked out pretty well remotely, and people were able to keep their productivity up and able to do things while also perhaps meeting family needs that they might not have been able to do as well when they were all living in the same place. So I working centrally. So I think that Teams has made a huge difference in that area, and I thank you and your software developers for what you've been able to do. I also want to thank Microsoft and Brad for the work I've gotten to do with them as part of the Seattle community. We've worked on a number of anti-racism projects and have worked to create standards within Seattle that businesses need to become anti-racist organizations. And again, Brad's leadership in that area has been incredible. And now one of the areas we're looking at is homelessness. And how can we create a culture, environment, world in Seattle that addresses, I think, a problem that all of us are facing every day. And that's, again, something that I'm incredibly privileged to be able to work with Microsoft on. The place where we are in Seattle is remarkable. I know that not everyone on this call is from Seattle or works in Seattle, but this is an innovative place. The innovation ecosystem that Teresa talked about is real. People come to Seattle every day with hopes and plans to try to change the world. And we do that at the Fred Hutch, and you do that at Microsoft in terms of what we do. A good example of that is the Cascadia Data Alliance. We have a relationship that Microsoft helps to support, which facilitates data sharing across organizations. And it's really pretty remarkable. And again, we think of data and data science as one of the ways that we're going to make a difference in cancer and in viruses. So again, really, really important. And finally, I want to just thank Microsoft's generosity to us as a corporate partner, both at the corporate level and among the people who work at Microsoft. In 2020, your employees donated a record-breaking $1.9 million to accelerate COVID-19 research. There was a great employee outpouring during the April 2020 Give Together match, and great support during Microsoft Give Month last fall. Back in April of last year, April 2020, Microsoft was the first company that we did one of these discussions with. And it was pretty remarkable that we saw how we could both inform and we could learn ourselves about what some of the questions are that people have. And we've learned a ton since then. We've done 50 lunch and learn events like this with organizations throughout the country and throughout the world. And we really look forward to coming back to Microsoft today to update you on where you are. And the last thing I want to do is thank Rich and Carmen Kaplan and Arup Roy, who've been really important in the Microsoft Obliteride team. Obliteride is one of our fundraising events in the summertime, and we hope that everyone from Microsoft who can will join us on August 14th. And this will be an important way that we raise funds for viral research, COVID research, cancer research for children and for adults. So it's really wonderful to be here.
I've thought a lot. I recall talking to you on Challenge Seattle calls, and I thought a lot about what a strange time it was to move to Seattle for you, just in the middle of everything. But I'm really proud that we got to show you what the city is all about. That's pretty amazing. Can you share how Fred Hutch came into the spotlight and responded to COVID-19 in the last 14 months or 700 years, whichever it is?
It seems like both. Yeah. It seems like both. Great. Say a few things. First, we have a lot of epidemiologists who started tracking the virus as soon as it happened. And you think about the work of Trevor Bedford to sequence the virus early on and start describing how it spread. So that was really important. Second, we've worked a lot on understanding what the virus does to the immune system. You're going to hear from some remarkable scientists today, people like Josh Schiffer, who will talk a lot about how he models the virus and thinks about it. I think our role in vaccine development, you're going to hear from Michele Andrasik, who's played a huge role in vaccine development for us, has been really, really important. And the Hutch has actually led something called the CoVPN, which produced 4 of the 5 large vaccine trials that help design the science behind them and the correlative science behind that helps us understand vaccines. We went ahead and built a clinical research center designed specifically to test new therapies for patients with COVID, which made a huge difference. And you're going to hear from Alpana Waghmare in a second, who's going to be able to tell you about some of the ways that we're working with children and COVID. So I've been incredibly proud of all the different ways the Hutch has made a difference in COVID. Viruses have always been part of our programs at the Hutch.
Well, I will tell you that I was on a Challenge Seattle call at one point when you were talking with deep and genuine enthusiasm about the advances in vaccines, and it was probably the first time I felt hope and optimism after many months of, sort of despair. And so I just wanted to thank you for that. We didn't plan this, but I wanted to say thank you because your enthusiasm actually really lifted my spirits and then helped me lift other people's spirits. So thank you. Why do you think Fred Hutch was so well positioned to take on a pandemic?
So I think it stems from the fact that we started as a cancer center, and we started bone marrow transplant, for example, was invented and discovered at the Fred Hutch. And what they found was patients who had bone marrow and bone marrow transplants and other types of leukemia were suffering a lot from viruses. So some of the early pioneers said, we better develop a research group that works in viruses. And we began working in a virus called CMV, cytomegalovirus, years ago. And we began developing groups that thought about vaccination as a strategy. And then we developed something called the HIV Vaccine Trials Network, which is a group that's working on developing a vaccine and a cure for HIV. And this is a big part of the Hutch. Before the pandemic, about 25% of our work is in viruses. Okay, now obviously that's grown since the pandemic, but we've always been a place where viral research has been important. So for us, because we had so many people like Michele Andrasik working in the HVTN, we were able to pivot. Now remember, we haven't stopped working on HIV. We're still working in HIV, but it allowed us to pivot and work in COVID, and it's made a huge difference.
It's just really amazing, and I always feel lucky to live here when I hear about the work at the Fred Hutch. So Microsoft, you talked about a little bit of this. Microsoft has a long history of collaboration with Fred Hutch. Can you share a few examples and the impact our organization and employees have had? I know there's a deep sense of pride to be able to help.
And Teresa, I think it's very justified. Microsoft employees, many of them are members of our community here in Seattle. Others are members of our community globally. They've always supported fearless science, and the generous matching program that the company offers is really important to us and to other nonprofits. Microsoft's worldwide generosity, we're among 234,000 nonprofits that received almost $2 billion in philanthropic support from you last year. So thank you to all of the employees, because remember, those start with employees making the decision to support important efforts in their communities. And philanthropy is critical to what we do. About 70% of our cost base is covered by federal grants. We need to raise money to cover the other 30% of what we do in cancer and in HIV. I also think the research partnership we talked about with Cascadia Data Alliance has been really terrific, and the interaction of your cloud computing group with our data scientists in cancer is something, again, we're very proud of. It wouldn't be able to happen without the ability of Microsoft to see the importance of cancer research. So thank you. I want to thank John Cahan, who's Microsoft's lead for Cascadia. This has been a really nice relationship, and I thank John for his efforts. He's the Vice President, Chief Data Analytics Officer for Global AI and Health at Microsoft.
Well, I know many of us have questions about COVID-19. I'm going to let Tom welcome the three Hutch scientists helping to lead national efforts. They are, as he has mentioned, Dr. Michele Andrasik, Dr. Josh Schiffer, and Dr. Alpana Waghmare. We will start today's conversation with Dr. Andrasik. So Tom, over to you.
Teresa, thank you. It is my pleasure to introduce Dr. Michele Andrasik. I have gotten to know Michele through many programs like this, and from watching her work at the Fred Hutch, it's absolutely remarkable. She's one of the directors of what I mentioned earlier, the CoVPN, or the COVID-19 Prevention Network. She and her team have done an unbelievable job ensuring that communities of color are adequately represented in the trials through outreach, education, and building trust nationally. The work's reflected in the trial results and the fact that the vaccines have proven to be remarkably effective with a really very favorable safety profile as well. And Michelle's leadership has been absolutely critical. As I mentioned, she has not stopped doing her day job. She's still also the Director of Community Engagement for the Hutch-based HIV Vaccine Trials Network. So, Michele, I guess the question for you now is, last night, I'm a big sports fan, okay? So I was reading an article. My favorite team, in addition to the Seahawks, but my favorite team was the New England Patriots. And so I always read about people, and there was this guy named Cole Beasley, who's a receiver for the Buffalo Bills. And he was talking about how he will not get vaccinated. He refuses to get vaccinated. And he said he thinks the vaccines are not going to help him. What does that mean to you? And that must be hard for you to hear as someone who's devoted your life and your career to this effort.
Well, thank you, first of all, for having me. I really appreciate being here in this space. Unfortunately, that is all too common. What we have seen throughout the development of the vaccines, and now that vaccines are rolling out, There's a great deal of misinformation. COVID has been politicized. And, it really is paramount that we continue to get accurate information to individuals and really have individuals weigh the risks and the benefits of, being vaccinated and continuing to be unvaccinated. I think a lot of individuals don't understand some of the risks of COVID, and they see that there are a lot of people who are being infected with COVID, and then they look at the numbers in terms of who is ill or the numbers that are dying, and they don't see anyone in their social networks that have been directly impacted. So, this isn't really going to impact me. But, we continue to get more information about what's happening with long haul COVID, even in people who were initially not symptomatic, are having symptoms, months later. Some of these long haul COVID individuals continue to have symptoms even after 7 months, which is how long many of them have been followed. So we're trying to get more of the information out there, and also trying to convey to people that there are many in our community who don't have the luxury to get vaccinated. Those individuals who are immunocompromised, for example, individuals who are receiving cancer treatment, and all of our children who are under the age of 12 cannot get vaccinated. And we're seeing with some of these variants, specifically the Delta variant, there have been news out of Israel and the UK about outbreaks, specifically among children in schools with the Delta variant. So I think all of these things, need to be more in the forefront when people are making decisions, because public health is not only about our individual health, but the health of our families and our communities. And I think that really is has to be factored in when we're making decisions about vaccination. And we're trying to get that information out so that people can utilize that to make those decisions.
Michele, are you happy with where we are now in this country in terms of vaccinations?
No, not, even in the states that are doing really well, like Vermont and Massachusetts, and we have plenty of vaccine now as a country. The rates in those states of people who are fully vaccinated do not exceed 59%. Washington and Oregon are approaching the 50% mark. And, I am so proud of us here in Seattle. We have exceeded 70% of our residents 16 years of age and older who've completed their vaccination series. And by June 25th, they will be fully vaccinated. However, even here in Seattle, in King County, Black and African American communities only have 53% of their community members who are 16 years and older fully vaccinated. And in the Hispanic and Latino communities, there are only 55% that are fully vaccinated. And then we have an entire block of states, Arkansas, Louisiana, Mississippi, Tennessee, Georgia, all under 35% vaccinated. Mississippi's at 27%, the lowest vaccination rates. And these states also have the highest number of Black counties. So counties wherein Black or African Americans represent 13% or more of the population. And, in these counties, we've also seen, and this is something that we've really looked at in HIV, there are syndemic conditions. So not only are there high rates of unemployment, high rates of uninsurance, but also high rates of diabetes, heart disease, and COVID. All of these pre-existing conditions play an important role in poor clinical outcomes for COVID-19. And we've also seen conflicting messages, politicization of COVID, and lack of information that have continued to negatively impact vaccine acceptability and uptake in these communities. And like I said, this really mirrors what we've seen in HIV. And that is that the health impact of social and political decisions and messaging is outweighing the impact of individual choices or the lack of individual choices. And I think it's really important to note that, we have 33.5 million cases of COVID in this country. And the data, the current data available as of today shows that we have over 12,000 new cases as of yesterday. So, and the cases are going up. So we have a lot of work to do. There's a lot to be proud of, but there's a lot more work that we need to do to ensure that we have adequate vaccination coverage and that coverage is equitable.
Michele, thank you. We're going to be back to ask a couple of questions to you in the Q&A. I'd remind the Microsoft participants that we will have a Q&A session with all of our speakers to answer your specific questions, and we ask you to submit your questions, and that will be terrific to be able to have those. I want to next introduce Josh Schiffer. Josh is an infectious disease physician and researcher. He uses mathematical modeling to understand the near infinite variables that cause infections to spread. And he was among the first to recognize the significance of the concept of super spreader events early in the pandemic. His latest research focuses on the roles of the super spreader events in the rise of variants. And he's been a terrific source of information during the pandemic. Early in the pandemic, he partnered with the actor Joel McHale in a series of conversations on Instagram, which helped get reliable information to a very broad audience. And Josh, thank you for your efforts in this setting. I guess the first question for you is, Michele and I were just talking about equity and the risk of increasing infections. Last summer we had a relatively low amount of virus in the United States, and we saw it explode when the summer ended. Michele's mentioned that the numbers might be ticking up a little bit now. Where do you see this? What do you see happening to the pandemic in the and what do you see happening in the fall?
Yeah, well, thanks, Tom, and thanks, Microsoft. It's wonderful to be here today. I think that there really hasn't been a mathematical model that can accurately predict what happens next. But I think the utility of the models is the ability to look at the variables that will most likely influence this. And I think that there's a growing concern that with, if the Delta variant is indeed 70% more transmissible than the Alpha variant, in the absence of a vaccine, that is extremely difficult to contain. And so, there's already a bit of a signal in Washington state that if you look at the fourth wave and you divide the lines and have one line among vaccinated, there literally is not a fourth wave. Whereas if you look at the line among the unvaccinated, it actually looks a lot like the third wave. And the reason this isn't affecting the hospitals and overwhelming the hospitals is thankfully, as Michele mentioned, we've done extremely well, particularly at the county level within King County and surrounding counties in terms of vaccinating a large number of people. But there is a real concern that the Delta variant or a variant that we're not aware of yet that, evolves either from the Alpha or the Delta that is more transmissible will pretty quickly burn through the unvaccinated population. And so that is a real concern, and I think that should be the target of our efforts at the moment. There's a less likely possibility, but something we can't rule out, which is that of a variant which responds much less effectively to vaccines. We've certainly seen this at the global level with the B.1.3.5 variant, which appeared to originate in South Africa, having a decreased vaccine efficacy, particularly with the AstraZeneca product. But thankfully, that has thus far appeared to be less of an issue with the Alpha variant and probably with the Delta variant, though that story is still emerging. But that would present a situation where vaccinated people might be at risk of outbreaks as well. But I do think that's the less likely of the two scenarios. But all of this requires very close tracking at the genomic level and also looking within these two subsets of the population at what the reproductive number is separately in those two populations and how the virus is spreading
And John,
in those populations.
what are we doing now to track variants? I mean, do you believe that we're doing enough to pick up not just the Delta variant, but the next variant that could be coming up?
It's from my understanding, it's certainly improving within the United States, but that it's not uniform. So it might, again in Washington, we have the incredible services of UW Virology, who have really been at the forefront of initially diagnostics and now sequencing, such that we're sequencing a higher percentage of viruses than in other states. But even outside of this country, there are areas where there are now substantial outbreaks where the sequencing is has much less penetrance. And so, sure, it's possible that a variant could emerge in Latin America or South Asia or Sub-Saharan Africa that we are not aware of that has consequences, beyond that of the Delta variant. So it's not complete at the global level, which, along with vaccine coverage, it really, needs to be for the global community to really emerge from this and where we can declare the pandemic over.
And Josh, the last question for you before we move on to Alpana. Where are we with treatments? There was a lot of excitement about remdesivir when it came out, and about the antibody cocktails from Regeneron and Lilly and others. Do you think we've made progress in treatment?
I do. I think the progress is very much, at the clinical trial level, where there have been really astonishing successes with monoclonals, and even a more recent result, which I would not have predicted, that the Regeneron product appeared to save lives among hospitalized patients. I've been an advocate for treating early all along, and that certainly panned out in terms of the ability of the antibodies to both prevent infection as well as limit infection among those who are treated early. But the problem is that the penetrance of those therapies into the general population is still very low, and they're not at all available in the developing world. And so we still, in my opinion, need a pill that we can disseminate broadly to the global community, such that a majority of people who are at high risk of developing severe COVID can get treated early. So great progress, but hopefully more to come.
Thanks, Josh. Next, I want to introduce Dr. Alpana Waghmare. Alpana is a pediatrician who's focused on respiratory infections in children and adults. She's focused on those who are immunocompromised and those who've undergone stem cell transplantation at the Fred Hutch and at Seattle Children's. She expanded her research to study the effects of COVID-19 on children who've got compromised immune systems, and she's been involved in testing the Pfizer vaccine in children under 12. So, Alpana, when you think about your role in this pandemic, when we started this whole thing, nobody was talking about children. Everybody was saying, well, children are lucky. They don't seem to get this disease. Then we started seeing some of the interesting inflammatory syndromes come out in children. And now there's not a parent who's not worried about their kids and not worried about what this could mean for their children. So I guess the first question is, can you tell us a little bit about what COVID-19 means to children? And is it something to be worried about? Is it not something to be worried about? How do you see this as an infectious disease researcher and as a pediatrician?
Yeah, thank you, Tom. And thanks again to Microsoft and Tom for inviting me to speak. It's really been a nice session so far. So yes, COVID-19 in children has thankfully been relatively not as severe as in adults. So we have less kids that are hospitalized compared to adults, less severe disease, and certainly less mortality, which of course is fantastic. But what we have learned over the past 20 months is that there are certain populations in kids that are more at risk. Some of those are similar to what we see in adults, kids with underlying comorbidities, obesity. We know that race and ethnicity play a huge role in which kids get sicker. And then kids with a compromised immune system. So it's not that all kids are protected. What we've seen clinically is that there are kids that will have severe disease, either from the acute infection, or as you alluded to, Tom, sort of the consequences of infection. And the term that is used to describe this is called multisystem inflammatory syndrome in children. And, I think we're just starting still to learn really what this is about. And we have some idea of what the risk factors are, but it can happen in kids that don't have any underlying conditions. They will be infected or exposed to COVID at some point, and then approximately a month later, they can develop a severe inflammatory syndrome that often ends up with them hospitalized and sometimes in the ICU, requiring quite a bit of support from either a ventilator or a cardiac support. So we do know that this exists. Luckily, still, this is a rare syndrome, but again, I just want to make sure that we understand that it's not, that kids are not completely immune from the consequences of COVID. And I think the other piece is just the long COVID that we don't really know much about in kids. And there are several large prospective studies looking at the impact of COVID in a longitudinal way in kids. So I think we have a lot to learn about what that looks like for children.
So, I'm also a bit of a news junkie, and I consume a lot of news product, and I really like CNN, and I would follow Dr. Sanjay Gupta's advice on pretty much everything. One day I was listening to Sanjay Gupta have a interview with a prominent pediatrician from Tufts in Boston, and the pediatrician from Tufts said that he would not recommend vaccinating adolescents and certainly not recommend vaccinating children until we had more long-term data on safety. Dr. Gupta pushed him on this and felt that I could tell that he thought that that was probably not the best advice. Tell me where you feel about vaccinating adolescents, and can you tell us about what's the vaccine status for children under 12?
Yeah, I think it's a fair point, right? We don't have, the truth is we don't have long-term data on vaccinating adolescents and what potential consequences there could be. But as with all things with COVID, I think, it's weighing the risks versus benefits. And in my view, I think the data from the clinical trials is, and now after the vaccine has been authorized for down to 12, all the clinical data that we have from all those adolescents being vaccinated still, in my view, shifts the balance towards benefit. And so I do think that we should still be vaccinating adolescents. And I think going back to the issue of variants, and now that we have more and more of our adult population vaccinated, there is going to be a shift towards transmission towards the unvaccinated population, which includes children. So I think there is concern that we will see more transmission events either at school or just among adolescents in general. In terms of the under 12 population, so there are several products being tested in this group. The furthest along are the 2 mRNA vaccines, Pfizer and Moderna. Both have trials underway that are phase 2-3 trials, so late stage trials to look at the safety and immunogenicity. So they want to see if the kids are making an immune response to the vaccine that is on par with what we've seen in the adult studies. And I know that there is a lot of interest in these trials, and their enrollment has really been going quite well because parents are eager to get their kids into these trials and get vaccinated. So I anticipate the enrollment will go very quickly. I don't have a crystal ball to predict when they may be presented to the FDA or approved. I think that is a big question still, but I do think that we're moving at a good rate. But of course, we need the time for the appropriate regulatory oversight to make sure that these vaccines are safe for kids.
And so I'll ask you one more question before we open up the Q&A, which is, in your opinion, should we reopen schools in the fall fully to kids?
Disclaimers, I don't have any authority here or to say in any of this, but, I think what we do know after, again, being in this situation for a year and a half is that kids benefit tremendously from being in school in person, and especially in racial and ethnic minorities, where access to appropriate online learning tools can be limited. And in general, for kids in general, being in school, especially young kids, it's really important for their social and emotional development. So to figure out how to do that while keeping staff and kids safe is the challenge. I personally would like to see that schools open and we continue the appropriate, depending on the particular community and transmission rates, we continue the appropriate protective measurements, including masking or social distancing or whatever it may be. But that our goal should be, I think, to get kids into school.
So I want to thank all of you for your introductory questions, and they were fantastic. We have about 15 minutes to take some questions from Microsoft. I know all of us on this call have called the Microsoft help desk and have asked questions to you guys. Think of us as the COVID help desk, okay? And you can call us and ask us questions about COVID. I want to start off, and we've gotten some good ones already, but please send more in. So this question is for Michele. It's a fantastic question, which is, what are we doing to understand the impact of the vaccine on female health, such as menstrual cycle, pregnancy, breastfeeding? Really important questions. I get this question a lot. Michele, how do you approach that?
Yeah, well, I think, as others on this call have said, we are looking into all of this. I often point people to the ACOG website, so the colleges of obstetricians and gynecologists, and they have the most recent data there. And since the beginning, they have been really recommending that women of childbearing age get vaccinated. Again, it's about weighing the risks and the benefits, and we have seen a disproportionate impact of COVID on pregnant women, and a lot of the recommendations are based on that. There are no indications at all in any of the data that I've seen and that I've seen on ACOG that would indicate that these vaccines have any negative impact on fertility and menstruation. One of the reports that I saw out of ACOG really underscored the fact that in young girls, menstruation is generally irregular across the board, and that the vaccination in and of itself is not associated with irregular menstruation. So I think that that's really critical. And again, I really point people to the ACOG website. It's very user-friendly and has all of the information there very well spelled out, along with the recommendations for women who are of childbearing age, who are pregnant, and who are breastfeeding.
Thanks, Michele. Next question is for Alpana, which is, what's the guidance for activities for unvaccinated kids? Okay, obviously all kids under 12 are pretty much unvaccinated, and there's others between 12 and 18 who haven't been vaccinated yet, i.e. when they travel, when they go out to eat, when they go to summer camp. And the question says, should I assume they should stay masked until they are vaccinated? How do you answer that for your patients and children that you see?
Yeah, I think to me it comes down to two things. One is what your local community transmission and incidences of COVID and sort of kind of the risk from that sense. And then the second is, as I mentioned, risk for kids is related to some of their underlying conditions. So if you have a kid that could potentially be more at risk for severe disease, then I think it's still reasonable to continue, sort of the same masking that we have been doing this whole time. I think, the data suggests that certainly outdoor activities are the lowest likelihood of transmission, and I feel comfortable, for example, with my kids being outdoors unmasked. I still think that indoors, when you're around people where you don't know what people's vaccine status is, I think it's still reasonable to consider masking in those situations. Some of this, again, is down to people's individual preferences and kind of their assumptions about their own risk. So it's a little bit down to of a personal decision in my mind too.
Mm-hmm. Okay, thanks. I'll have a question for Josh, which is, and this is a question that I've actually had friends ask me. So there's a lot of people out there who are immune compromised. They're either immune compromised because they've got a disease or they're taking a medication that suppresses the immune system. People who've got multiple sclerosis and people who've got lymphoma, and there's a whole bunch of diseases and treatments that can suppress the immune system. And many have gotten vaccinated, but they don't know really whether they've gotten a good immune response to the vaccination or not. Is there a way to find out if that immune compromised patient is more vulnerable to breakthrough COVID? Do they need to continue to isolate? Are they more vulnerable to the variants? Josh, how do you answer that?
Right. It's a wonderful question. It's one we are adjusting to very rapidly in our care for our patients at the Seattle Cancer Care Alliance. There, I think, is emerging evidence that there is what's called a correlative immunity. Mike, I hope you all can't hear my cat. She's talking in the background. But yeah, there's a correlative immunity, meaning that above a certain antibody level, there is protection against infection. The studies that have been done are really elegant, but the problem is that the way the antibodies have been measured across the globe have been with slightly different assays and in slightly different labs. But the trend really does appear to suggest that I think in the not too distant future, we'll be able to check an antibody level on somebody and tell them whether they're relatively protected. There's also a very early data among a very small number of study participants suggesting that a third vaccine might actually get people over the hump. But I need to caveat that with the real issue with studying immunocompromised patients is that it is such a heterogeneous group. And so, you know, there are people we would label immunocompromised in the strictest sense of the word who will probably respond beautifully to 1 or 2 mRNA shots, whereas somebody following a stem cell transplant is on the other extreme of the spectrum and are really the most immunocompromised people. And so it's not a one-size-fits-all answer, and it's going to be a very hot area of research, I think, for years to come.
Okay. So, Michele, a question for you, which is, you noted the big discrepancies in vaccination rates among people of color in the United States, and the geographic differences that we have. What do we do about that? Meaning, the one thing I'm concerned about is that it's very easy for us to say, well, Black people have mistrust of the health system and almost in a way blame people for not being vaccinated. How do we turn this into a more productive discussion, and how do we address some of the reasons that people aren't vaccinated in these communities and try to change that?
Well, I think that Seattle actually has really modeled what to do for the rest of the country. And that is, taking vaccines to communities. The Seattle King County Department of Health teamed up with the fire department and the city of Seattle to have mobile units and pop-up vaccination sites. And, although I mentioned earlier that the communities of color, particularly Black, African American, Hispanic, Latino, are still falling behind in terms of vaccine uptake, Seattle is one of the cities that has the most equitable distribution. And I would say that is largely because of these mobile units and these pop-up vaccination sites, and also ensuring that there are messages for specific communities. Our team is pairing up, for example, with the Washington State Department of Health, and have gone to the east side of the mountains to really talk to people to understand what some of the hesitation is around vaccine uptake. in some of the communities on the east side of the Cascades that have the lowest vaccine uptake, and really going to leaders in those communities, having these conversations to really get to why it is that people aren't vaccinating, and to create messages and address some of those barriers. Some of the other initiatives that have been incredibly successful are the Train the Trainer. So teaching community leaders, community stakeholders, family members, how to talk to people about the vaccines, addressing fears of side effects, addressing some of the fears around infertility, the fact that people perceive the vaccine as having come about too quickly. So really giving people the information so that they can then go into their communities and have these discussions. One of the initiatives that I'm really excited about that's coming out of the White House is a barbershop and beauty salon initiative, wherein we are training beauty salon owners and barbershop owners to be able to have these conversations with individuals who are seated in their shops, getting their hair done. And if these beauty salon and barbershop owners want to host a pop-up vaccination site in their respective businesses, they can do that as well. And I think these are the kinds of initiatives that we've seen are successful and that are really going to make the difference in uptake and acceptability in communities.
Thanks, Michelle. So, Alpana, this will be a question for you in your role as not as a pediatrician, but as an infectious disease doctor. So, is it true that people who are vaccinated can still develop COVID and get sick? I also heard people are dying of COVID even after vaccination. So that's the question that came in.
Yeah. So what we know is that certainly people that have been fully vaccinated can get infected. And these are what people are calling breakthrough infections, basically. What we know is that by and large, most people that get infected post-vaccine have either asymptomatic or very mild infection. And at least some of the data suggest that they have very low viral loads if they get infected post-vaccine. So we don't think that this is a source of transmission, at least a large source of transmission. That being said, of course, there are cases that have been described of people having more severe disease. I think at least my grasp of the data is that these are people that have other underlying comorbidities, older individuals that have sort of that happen to them. It's not sort of the general healthy population. So yes, it can happen, but I think the takeaway is that by and far these are mild infections that can happen if you're fully vaccinated.
Thanks, Alpana. One thing I will say to the Microsoft folks, you guys are coming up with some fantastic questions. These are great questions. So this is a hard one for Josh. Okay, Josh? And so you guys don't get to see these, so I can sort of preview them a little bit, but this one is a tough one. So this is from a Microsoft employee, and it says, as far as a pandemic goes, we couldn't have asked for something more benign. Do you view this pandemic as a relatively benign dress rehearsal for the next pandemic? For example, smallpox has an R0 between 5 to 7, and COVID-19 is 0.7 or so. So do you agree with this question, Josh, that this is a benign pandemic?
Yeah, I think it's a great question. I would never call a pandemic that has killed, at least several million people across the globe benign ever, including, easily over 600,000 Americans. But the thought has crossed my mind that this could be a dress rehearsal for something far worse. So, the most likely source of a pandemic is probably a bird flu. That would carry an R0 that might be comparable or a little lower compared to SARS-CoV-2, but has a completely different set of challenges in terms of stopping its spread. Fewer super spreader events, but much higher likelihood that any one person will infect another person, but also a much higher mortality rate. I think and then you can imagine that mortality rate being cast upon a younger population. That's very hard to think about. I think that even in the worst of times in March, we didn't completely shut down. You could still go to the grocery store. But there, I think there is a scenario in which the lockdown would be much more severe out of necessity. So in some sense, this was a practice run, and we obviously did not, as a nation and at a public health level, got a few things right, particularly the vaccine, but a lot more things wrong. And we need to learn from this. And my take-home message, not just as someone who wants to receive this funding, but as a citizen, is that I think pandemic preparedness needs to represent careers for a lot of people who have developed the skill set to think about this, because without a question, there'll be another pandemic. And I can't tell you whether it will be more severe than this one or less severe, but there'll certainly be another one. And I hope we're better prepared next time.
Thanks, Josh. Michele, you're going to get this next one, which is a tough question. So it says there has been much promotion of the vaccine, but little to no conversation about natural immunity. My own doctor says I do not need to get the shots because I've already had COVID, and that it furthers inequity for us to get the shots while others cannot get access to them. Can you speak to the continued need to mask after having natural immunity? Follow the science seems to be being politicized by saying the vaccine is the only way.
Well, there has been data that indicate that natural immunity is not as effective as the vaccine. So I think that looking at that data and really making your own decisions around what you need to do as an individual. I wish I had the graph here, and I can send this to all of you at Microsoft if you'd like, but there is a graph that came out of the CDC that compares natural immunity across the different variants to vaccine across the variants, and looking at efficacy of the vaccines and natural immunity across all of the variants. And there have been breakthrough infections in individuals who have been infected with one, like the original variant, as opposed to later variants. So I think I would have to forward that to you. I don't have it on hand now to really answer that question fully, but I can make sure that you all get that. And it's really easy to understand. We actually have a Dropbox of materials that I can also share with you if I can share something in the chat where we have all of this information. It's a publicly available Dropbox with information on all of the questions that we've gotten since the beginning of the pandemic about the vaccine and vaccine uptake.
So Michele, thank you. Last question is going to go to Alpana. So Alpana, the question is, what about the booster? Do we all need a booster vaccine in October or November? Should we start planning to be able to distribute vaccines so we can all get our booster then? What do you think about booster vaccination and a third shot?
Yeah, I think, I don't know the answer if we're going to need it, but I think we should be thinking about the possibility. And at least a couple of the organizations and sort of larger study groups are looking at the possibility of the need for a booster vaccine. So I guess maybe I'm hedging a little bit, but I do think that we need to be prepared for that possibility. Whether it actually happens or is needed, I don't think we have that answer yet. Happy to hear from Josh or Michele if they think otherwise.
Josh, Michele, do you think we'll need a booster?
Yeah,
all signs are pointing in that direction, but I don't know.
Yeah, I agree with Alpana's uncertainty. I think we'll see. Yeah.
So I want to thank the panel for a fabulous discussion. I want to thank the Microsoft employees for great questions. These were fantastic. And also for your partnership in battling COVID and in looking for cures for cancer. Teresa, thank you so much for welcoming us. It's really been a terrific morning.
Well, thank you to all of you. I have just maybe a couple additional thoughts. One, Josh, it was really nice to meet your cat. Two, as a lifelong Buffalo Bills fan, I would like to apologize for Cole Beasley, except when he's catching the ball. And three, I'm just so honored both to get to hear from you all today, but much more importantly, to live in a community where you work and do this really hard work that helps all of us. For those of you who would like to learn a little bit more about the work Fred Hutch is doing, you can sign up for research updates. We've got the link here on the slide. And if you're interested, be sure to join the Microsoft and Friends Obliteride team. I hear we have a friendly competition with Amazon. Go Microsoft. Many thanks to all of you for joining us today. Please take care of yourselves. Thank you.